One of the things that is worth talking about is kind of the difference between the HydroEye omegas and traditional omega-3s. One of the things that I think is really important is that it's been studied in a randomized control trial. When we recommend supplements, a lot of supplements out there don't actually have clinical data. And to me, actually, I think when I talk to my patients, it kind of shines through when I can say, this has been studied in patients with dry eye, and it produces, a significant effect. What are the things that you like about it?
Well, I would say, a lot of my patients come in on some form of omega supplement, and we do know that omega supplementation is the most common vitamin supplement that patients are taking naturally. And so there is not good data for the various supplements. In fact, I've even gone to my local health food store and looked at the supplements that are available out there, and it's really overwhelming. There's several hundred different varieties of omega supplements, which have all sorts of variable ingredients in them. And I've been overwhelmed myself, and certainly patients must feel the same way. So as you have mentioned, it's really nice to have some science behind the product that we're recommending. And so I do tell them those products really have no scientific basis to them, and there's nothing controlling what's put into those products.
And don't you feel that patients kind of think all supplements are created equal?
They really do.
And they're not thinking about kind of the important aspects, which is you are putting something in your body. We should know if it's working before you take that. And so I find that sometimes patients are taken aback by there's data around it. And it makes them question what they are taking and why. And I think that's an important aspect for compliance and adherence to therapy in that patient population.
Yes, and I've been recommending HydroEye for many, many, many years. And the main thing that got me started using HydroEye was the science behind it. I was very impressed with the team at HydroEye. And anytime that I had asked for scientific data, they were able to produce that for me. That made me feel much more comfortable in using it myself and for patients. And so I like to be able to share that with my patients as well, to say this is not random. This has really been proven on even a cellular level. There's some data to show that this is a good formulation, and it's very easy and tolerable for patients. So a lot of times they'll think, oh, it's some form of fish and that type of thing, but it doesn't have an odor. It's a very small capsule. It's very easy to tolerate for patients. So and that helps.
That is important too for compliance and adherence. Nobody really wants to take a big horse pill, and a lot of times patients will say, "Oh, I tried omegas. I couldn't take them before." And so I think knowing those particular advantages, as you mentioned, of HydroEye, the small capsule, the lack of fishy taste or smell, it makes it a better experience for the patient. And then from our side, knowing that it's targeted and that it is scientifically validated as a treatment for dry eye, it's kind of a great combination.
I agree.